Hi, everyone. My name is Dr. Christine Anderson, and I am a Los Angeles-based chiropractor who specializes in pediatrics and pregnancy and childhood developmental disorders. But really, my favorite thing is helping families grow up healthy. So I am going to talk a little bit about 7 facts you may not know about chiropractic. Sometimes people have misconceptions about chiropractors and what they do. So I am here to hopefully give you some new information that you don't have. So here we go. All right, fact number 1, the chiropractic principles are ancient. So chiropractic is built on the principles that the brain controls the function of the body through the nervous system, the spine and the spinal nerves coming off, and then the body is able to self-heal and self-regulate itself because of the brain's input. So this was founded, this principle, chiropractic principle, of the modern age was founded about 120 years ago by D.D. Palmer in Davenport, Iowa, and there's still a chiropractic college there, bearing his name, Palmer Chiropractic. And it's a really cool story. And you know what? I'm going to do a separate video on the story of chiropractic, but in essence, he was a healer, and a man came in, a janitor, who was deaf, and he became deaf after he had felt something pop in his spine. D.D. Palmer hypothesized, well, if something popped out, maybe we can pop it back in and restore the hearing, and that's exactly what happened. So that is the famous story about how chiropractic was born. And I'm sure you didn't know that fact because not many people do unless you are a chiropractor. But basically, cruder forms or basic forms of chiropractic manipulation have been done throughout the ages by the ancient Greeks and other civilizations. And then Hippocrates, who we consider the father of modern medicine, stated physical structure is the basis of medicine. So he really put an emphasis on the importance of the spine to good health, probably for the reasons I just mentioned. Now, yogis will measure the age of the person and the health of a person by the flexibility of their spine. And most people in the Western world would fail and be considered probably elderly, even some at a young age, based on that criteria. Thomas Edison stated, "The doctor of the future will give no medication but will interest his patients in the care of the human frame," that's the spine and the skeleton, "diet, and in the cause and prevention of disease." And that is really what chiropractors do. So a lot of my time is spent educating and teaching about basic health principles. So we refer to the 3 stressors of physical stress, emotional stress, and toxins that cause the spine to become out of alignment. And then how patients can take care of these stressors to help maintain their adjustments and keep their health. And a lot of that is revolving around a lifestyle, so diet, and a lot of the times we can prevent by working with things in our life. So that's exactly, the doctor of the future is here, and they're called chiropractors. All right, fact number 2, adjustments are not random. This is one of the reasons why I do a full history and full chiropractic examination before I ever put my hands on a patient to adjust them, no matter what their age, no matter if they've been to a chiropractor before. I have to know what I'm working on so I can be the most effective, and also so that I am not going to harm anyone. So I am using so many modalities to figure out where a patient is out of alignment or subluxated, or if things are restricted, not moving, if there's asymmetries going on with the communication of the brain and the rest of the body. So, of course, in the history, I'm going to listen to the patient. What's bugging them? What are their symptoms and pain patterns? I'm going to look at their posture. I'm going to touch their spine and move it around possibly and feel their muscles and look at their ranges of motion, whether it's active, that's them doing it, or passive, that's me moving the body. I'm going to look at their gait. I'm going to look at their feet. Maybe I'm doing some x-rays. So these are all things that I can use, and there's more, but these are some of the basic ones to see exactly where I'm going to be working. And adjustments are specific vertebra, so I know exactly which vertebra I'm on, which part of the vertebra I'm on, and in which direction I'm actually moving that vertebra. So this is why chiropractors call the techniques that they do and what they're doing using spinal adjustments, specific spinal adjustments versus manipulation. And this is what osteopaths typically term what they are doing on the spine, which to me are more general movements. It's just kind of like, let's push here and there and just see what we can get to move. So that's a little bit different with chiropractors where I'm specifically moving things. So I alluded this in the beginning when I talked about chiropractic philosophy being a premise that's been going on through the ages. But most people don't really think about that their brain controls every single function in the body. Every single function. Nothing will work without the brain. Muscles, organs, immune system, hormonal system, every single system has to have input from the brain or it is not going to work. So an extreme circumstance of this would be somebody who's paralyzed. So let's just say they are a paraplegic, so they're paralyzed from the waist down. That means they had some injury to their spine, and past the injury, the nerves are unable to tell the body how to work. So that means they can't walk, their bowel and their bladder will be affected. Everything below the waist is going to be affected. If it's a quadriplegic, and that's from the neck down, that means their arms aren't going to work, their hands. They're going to have trouble with their lungs and need assistance with clearing the lungs. So that's a dramatic example. On a more microcosm level, if you have subluxations in your spine, misalignments affecting the nerves going out to every single part of the body, then the brain can't send those signals out. It's sort of like unplugging the cord. You've got your equipment there, but it's not going to work unless it's plugged in to some electricity and the power supply, and the control source for us is our brain. So any misalignment, or subluxation is the term that we chiropractors use, is going to interfere with that communication. And then chiropractors like myself will come in, make our specific adjustments, and then that information can flow, that information superhighway from the brain to the body, and then the body can self-heal, self-regulate, because it has top-down control from the brain. Number 4 is chiropractic affects sensory input. So most people get, okay, the brain tells the body what to do, but we forget that there's also input from the body up to the brain, and believe it or not, there is more input into the brain than there is coming out. So everything that you are taking in your environment, all your senses, touch, smell, sight, sound, pain, pressure, an internal proprioception, that's one we often don't think about, and I didn't write it in here, but that is sensors in your body to tell your brain, where's your ankle? What is your gut doing? Internally, what is happening? So it's not just the outside coming in, but it's also your inside telling your brain what's happening. And then the brain goes, oh, okay, we've got this going on, we've got that going on. There's a car coming at me, I better jump out of the way. Oh, there's a curb here, my ankle kind of twisted, I better make an adjustment. Etc. I've got internal signals from my stomach, I'm hungry, so my brain is going to go, oh, I better eat, that type of thing. So if you have spinal subluxations, your brain may not get input at all, zero, or it may be reduced or not getting the correct information. So another extreme example of this would be a person who is deaf. If they are deaf, that means, well, they have an ear, but the inner ear that takes the sound waves and transmits a signal to the brain, which is where we actually hear, isn't working. So it could be, that's kind of a complicated one with deafness, because it could be the internal ear, or it could be the nerves going to it. So maybe not the best example, but anyway, if your brain isn't getting those signals, it's not going to be able, so like junk in, junk out, if you're not able to tell what's going on in your world, externally and internally, then how's your brain supposed to know the signals to send out to adapt and respond? So with chiropractic adjustments, chiropractors remove the subluxations, the brain can get those proper signals, and then send out the appropriate response to respond to the situation, which is super important. All right, number 5. Did you know there are a ton of studies on chiropractic? And fill in the blank, so many things. In general, people's quality of life is improved, and they found this through studies. So after 12 weeks of chiropractic care, a study showed improved physical component. So physically, they were better. They had a better quality of life. After 12 weeks, participants were having better sensory motor function. What is that? The sensory motor is they were able to tell what was going on in their environment, and then their brain send the signals to move their body, the motor component. And so what happened is they had reduced fall risk. So remember I talked about, oh, there's a curb there. I'm going to make adjustments so that you don't fall. Because if you cannot perceive that there is a change in the ground level and you're stepping, then you're going to fall. And you'll notice too that a lot of older people look down at the ground because that internal proprioception of where their feet are is not optimal. So they have to look to see where the ground is. So there's been studies that show chiropractic care can change the way your brain sends messages to your muscles. Go figure. There's a study showing chiropractic care can make you stronger. So the changes in the central nervous system are similar to what has previously been shown after 3 weeks of strength training. Isn't that pretty incredible? So if you are actually an athlete, chiropractic is one of those secret weapons, so to speak. And I do know there are a lot of athletes that use chiropractic basically to keep them aligned so that they have less injuries. And there may also be this effect of being stronger because the brain can send the signals to the muscles effectively as it should. Now, one area of the brain that is been shown to be affected by studies by chiropractic adjustments is the prefrontal cortex of the brain. So this is the front part that is right underneath here. And this is a higher executive function. So, what we need to exist in the world and think and communicate and have relationships and personality. So this is the area of the brain. But there are numerous studies. There's studies showing chiropractic helps with blood pressure issues, and I could go on and on and on. So chiropractic, basically, once you think of the premise of chiropractic and the philosophy, it makes sense that you would see changes in all systems. It's just a matter of whether it's been studied or not. And that's a whole other thing with studies, because if we take them built on the medical model with the double-blind placebo, well, that's really built around drug studies. It doesn't really work so well with therapeutic or hand-based studies where there's really an art to this as well. You're taking into consideration the person that you're treating and not just a protocol. Now, number 6 is chiropractic care is safe, relatively safe in the modern medical world, but it has been looked at for safety. Researchers concluded chiropractic care for babies and children is rarely associated with any adverse effects. I've been seeing babies and children now for over 30 years. And when I'm working with a baby or a young child, how I work with that child is not the same as I work with an adult. So the technique and the how much pressure you're putting in and that type of thing is going to be different depending on the age of the person. Same thing with older people. If you have an elderly woman who's osteoporotic, I'm not going to just do a high velocity thrust on them because they would be at risk for fracture. Babies actually are more cartilage in their spine than anything else, so they really are more flexible. It's really, really hard to injure babies, believe it or not, because people think they are so delicate. I mean, you don't want to throw them around because the brain will slosh inside their head, but I don't need to do a lot with them because they don't have the same issues that adults do. So it's very gentle, almost no pressure at all, maybe occasionally a little finger push tap, but nothing like an adult adjustment. So chiropractic adjustments can range from basically no force to high velocity force, which is what people think of with a chiropractic adjustment. And really, the biggest sort of after effect is sometimes patients will have some soreness, like they've over-exercised. But most of the time, the after effects are beneficial. They feel better, they're sleeping better, they're moving better. Even if they came in for another thing, oftentimes they'll report increase in their quality of life. Another way you can kind of gather whether a modality is safe, believe it or not, is looking at malpractice insurance premiums. So many years ago, I had a birth center on the second floor of my building where I have my office. So it was midwives running the practice. It was just in my building. And they were leaving, and I was thinking, well, maybe I would get a birth center going, of course, with midwives and an obstetrician as a backup. And when I was looking at malpractice insurance for that, it was $1,000 per week. Crazy. That's crazy. Chiropractic has one of the lowest malpractice insurance premiums. It depends on how many hours you're practicing, so it's different, and different carriers have different plans. But basically, it's maybe a few thousand per 6 months. not per week. So, of course, the practice of birthing babies has a higher risk associated with it, hence the higher premium. And so this is just kind of one of the ways that you can garner when you're doing a health modality is what is the safety? Well, if it wasn't safe, the insurance premiums would be higher. All right, number 7, babies should be adjusted. And you would say, what do babies need to be adjusted for? They just got here. They just were born. What are their problems? They don't have neck pain and back pain. Well, that's because a lot of people misunderstand chiropractic and think it's all about neck and back pain. And don't misunderstand me. It is really a blessing when you do have neck and back pain to have an adjustment because it helps tremendously. However, the premise, the philosophy that everything is controlled by the nervous system, it should be started at birth so that you can take care of any issues that are created by birth, that there may not be any symptoms that pop up yet. Why wait till so much water's gone under the bridge when you have symptoms if you can take care of these things right away so that the brain development and the neurologic development and the spinal development have the absolute best ability to develop from the get-go. So the other thing is that sometimes babies do have issues, and I see this all the time, whether it be issues with breastfeeding, which is so important to get established. That's everything for a newborn and for a mom trying to breastfeed, or if they're having issues with sleeping, constipation, reflux, rashes, asymmetry, torticollis, so many things, flattening of one head. You definitely want to get your baby checked out by a chiropractor who has training in pediatrics. That is super important because there's a little bit to know before you adjust babies. Just because a chiropractor can, and any chiropractor by law can adjust a baby and children, I personally feel that it is important if they have additional training. So you do want to make sure that that is the case. There's also been some studies with things like colic, and chiropractic has been shown to help colicky babies cry less. So there's been also some reports or anecdotal responses where women are reporting that their labors are less in time when they get regular chiropractic care. So that's also a bonus because, of course, the labor and delivery is going to affect the baby, and it's also going to affect their positioning inside and their development inside. So everything really kind of goes back to the pregnancy to move forward into the labor and delivery of the baby. But for sure, we want to make sure those babies are checked out as soon as possible after birth. And then if there's nothing going on with that baby, everything's progressing as it should, they should be seen once a month in that first year of life because their spine and their brain are developing very rapidly. And we want to make sure all those milestones are hit and all the primitive reflexes are there and that they're integrated. So super important for development. That foundation is everything. All right, so you've made it through. Now you are well educated. 7 facts you may not have known. Now you do. So you can find me at www.losangeles-chiropractor.com. Reach out to me if you would like some chiropractic care for your family. I do in-office adjustments, of course, but I also can do a lot of things remotely, consultations, neurologic evaluations, and then recommendations for lifestyle with exercises, diet, nutrition, parenting, you name it. Because not only am I a chiropractor, of 30 years. But I also am the mother of 3 adult children. So I have been through it, seen it, helped it. I've got a lot of tools in my tool belt. All right, that's it. I hope you enjoyed this program. If you have, please do give me a thumbs up. It does help with distribution of the video. And please subscribe and hit the notification bell if you would like to get notified when I am putting out a new video. I typically am coming on every single Tuesday night at 6:30 p.m. or thereabout, somewhere in that range, if you want to watch live. And I do entertain questions, so I do look for comments, and I will incorporate any comments and answers if it's applicable to the topic that I am on, and if not, I will reach out to you later. All right, have a great week, and I will see you next time.